Hi friends, I welcome you to yet another episode of my YouTube channel Future Midwife. Today's our topic is preterm contraction. This preterm contraction is otherwise known as preterm labor. In this condition, mother experience regular uterine contraction which result the cervical changes such as dilatation of the cervix and effacement of the cervix. So, which can be occurs after 20th weeks of gestation and before 37 weeks of gestation. It is nothing but the regular uterine contraction mother experiences between 28 to 37 weeks of gestation is simply we called it as preterm labor or preterm contraction. As earlier the delivery, the greater the health risk of the newborn in the future because the fetus is not developed much properly when the delivery occurs before 37 weeks of gestation, which can lead to some structural and developmental abnormality for the future. Here we'll discuss about the causes and risk factors of preterm contraction. These are multiple pregnancy. Multiple pregnancies such as twins, triplets can lead to preterm contraction because here the mother's uterus may not be having sufficient space for the growing fetus, which can lead to preterm contraction. The second one is previous preterm labor or preterm contraction. If the mother experience any previous history of preterm labor can lead to preterm birth during the next consequent pregnancies. The third one is uterine or cervical abnormalities. The uterine or cervical abnormality in the sense like a bicornuate uterus, septate uterus, unicornuate uterus, double uterus, these all structural abnormality can lead to preterm contraction. The fourth one is infection. Some bacterial and viral infection can lead to preterm contraction. The fifth one is chronic medical conditions such as hypertension, diabetes or kidney disease. The sixth one is lifestyle factors like smoking, substance abuse or poor nutrition also can lead to preterm contraction. Let us discuss about the sign and symptoms of preterm contraction. Obviously, mother experience mild to severe uterine contraction. This uterine contraction will be regular along with the cervical changes also can be expected in case of preterm contraction. The second one is we can see the vaginal bleeding or amniotic fluid discharge from the uterus. Some mothers experience abdominal cramping, especially the tightening of the lower uterine segment. The next one is pelvic pressure, feeling of pressure or tightening of the pelvis. Apart from that, some mothers experience low back pain also. So these are the main signs and symptoms of preterm contraction. Next, we'll see the diagnosis of preterm contraction. The first one is physical examination. In the physical examination, we can perform vaginal examination. In that, we can identify the cervical dilatation and effacement. The second one is ultrasonography. In the ultrasonography, we can identify the fetal heart rate and uterine contraction pattern. The third one is fetal fibronectin test, checking for a protein in vaginal secretion that can indicate preterm labor. The fourth one is maturity amniocentesis. In case of maturity amniocentesis, the healthcare providers might recommend a procedure in which amniotic fluid is removed from the uterus to determine the baby's lung maturity. The technique can also be used to detect an infection in the amniotic fluid. So these are the main diagnosis of preterm labor. Here we reach the treatment aspect of preterm contraction. Treatment for preterm contraction may include bed rest, reducing physical activity to alleviate the contraction. Second one is medication. Medication such as tocolytic medication to slow or stop the contraction. The example of tocolytic drugs are prostaglandin synthetase inhibitors, calcium channel blockers, oxytocin antagonist and magnesium sulfate. The third management is corticosteroids. Administration of corticosteroid to promote fetal lung development. If the period is between the week 24 and 34, the healthcare providers might recommend an injection of potent steroids to speed the baby's lung maturity. After the week 34, the baby's lung might be mature enough for delivery without steroid. The fourth one is cervical encirclage. For some women, a surgical procedure known as cervical encirclage can help to prevent premature birth. The management of preterm labor we can decide according to the gestational age. If the gestational age is 34 weeks or more, we can proceed to delivery usually by induction of labor. Along with that, group B streptococcal prophylaxis also recommended. If the gestational age is 32 weeks to 33 completed weeks, here also expectant management unless fetal pulmonary maturity is documented. Group B streptococcal prophylaxis is recommended. Corticosteroids also can be administered in this gestational age. If the gestational age is between 24 weeks to 31 completed weeks, here also we can perform expected management such as Group B streptococcal prophylaxis, single course of corticosteroid, tocolytic agents and antimicrobial to prolong the latency if no contraindications. If the preterm labor occurs before 24 weeks, we can give patient counseling. Expectant management or induction of labor can be done. Group B streptococcal prophylaxis is not recommended. Corticosteroids are not recommended. These are the management of preterm labor according to the gestational weeks. The complications and preventive aspect of preterm contraction will be displayed on the slide. Please have a look on it. So here we can wind up our today's section. It is a simple topic, but exam point of view it is very important. I hope all of you understood about the preterm contraction. In the next class we will meet with another episode of midwifery topic. Till that, take care. Bye bye.